Our presentation is on the research paper Antibiotic Treatment Duration and Long-Term Outcomes of Patients with Early Lyme Disease from a Lyme Disease Hyperendemic Area. Introduction. Lyme disease is one of the most common diseases born from ticks. If untreated, patients can develop later symptoms such as arthritis. However, if treated properly with antibiotics, there is a much lower risk of late symptoms. It is common for patients to complain about symptoms, so physicians regularly prescribe prolonged antibiotics, despite evidence showing the effectiveness of short-term courses. The researchers hypothesized that a shorter antibiotic course would prove to be more effective and set out to determine the differences in long-term outcomes between long-term and short-term antibiotic courses. Methods. This study was conducted with patients who had early localized and early disseminated Lyme disease. Patients who had early Lyme disease were specifically selected and were sent a questionnaire to assess their current health status. They then grouped the patients into three groups: those who had antibiotics for less than 10 days, those who had an 11 to 15-day course, and those who had antibiotics for more than 16 days. The survey results and the long-term outcomes were collected from all patients. The primary outcomes were called treatment failure. This occurred if the patient had persistent lesions called erythema migrans despite antibiotic therapy. Treatment failure also included findings of progressive Lyme disease that was not present in the initial diagnosis or after antibiotic treatment. The secondary outcome was possible treatment failure. During follow-ups, if patients were treated with additional antibiotics following a positive Lyme disease test, it was considered possible treatment failure. Data was collected by medical record review, a clinical status questionnaire, and a SF-36 health assessment survey. If there was a potential case of treatment failure, it was reviewed independently by the researchers.
As for the results of the experiment, how many patients were treated? Patient research shows that a total of 607 patients met the study inclusion criteria, and it also showed that 458 of the 607 patients showed signs of local Lyme disease, while the rest of 159 patients showed signs for disseminated Lyme disease. The patients were treated with doxycycline for durations of more than 10 days, 11 to 15 days, and more than 60 days. Now, 69% of the patients stated that they've been exposed to ticks beforehand, but only 30% reported being bit by a tick. Now, during the antibiotic treatment phase, 93% of patients were treated with an oral dose of doxycycline. The average duration of antibiotic treatment were as follows: 17.1 days in patients with early Lyme disease, 18.4 days in patients with early disseminated Lyme disease, and scientists also found out that 8% of patients were treated for longer than 21 days. Now, out of all the number of patients, only 24 patients did not have the sufficient amount of medical information to determine their duration of medical treatment. It is also noted that of the 100 patients who received less than 10 days of antibiotic treatment, 95 patients received 10 days of therapy, and only one patient received fewer than 7 days of treatment. Now, moving on to interpretation, we're going to look over treatment failures, side effects, treatment success rate, and, most importantly, were the scientists right? Now, looking at the data, the numbers look great. However, there is one aspect of the treatment trials that we have not discussed yet. That one aspect is one of the most important as well. The aspect is the treatment failure criteria portion, which was only present in 6 patients, which is 1% of the population. The treatment failures resulted in 4 out of 6 of the patients, which suggests reinfection from the Lyme disease after treatment. Out of these patients, one of these patients were treated with an inappropriate antibiotic, and another developed facial palsy, which is facial paralysis, during the early stages of the therapy. Although there were slight setbacks with these failures, the research shined through the 2-year treatment failure-free survival rates of the patients. The patients that were treated with antibiotics for less than 10 days had a survival rate of 99%. The patients that were treated for 11 to 15 days had a 98.9% survival rate. Lastly, the patients that were treated for more than 16 days had a survival rate of 99.2%. Now, what does this data mean? This data shows that patients treated for less than 10 days with antibiotic therapy for early Lyme disease had long-term outcomes similar to those treated with longer courses of a period of time. It has also showed that treatment failure is extremely rare to occur, which shows a high success rate, which is why the scientists' data supports their hypothesis.
The conclusion of this paper is that patients treated for less than or equal to 10 days with antibiotic therapy for early Lyme disease have long-term outcomes similar to those of patients treated with longer courses of antibiotic treatment. We agree with this conclusion of the paper because the results of this clinical outcome study, which to their knowledge is the largest reported series of patients with early localized and early disseminated Lyme disease, suggest no difference in treatment failure rates or long-term health function among patients treated with targeted antibiotics for less than or equal to 10 days, 11 to 15 days, and greater than or equal to 16 days. Additionally, reinfection was much more common than treatment failure, and treatment failure as defined for this study after appropriately targeted short course therapy, if it occurs, is exceedingly rare. And pictured is how antibiotics like doxycycline in this experiment block vital processes in the bacteria and stop it from spreading, if worked effectively. So for the future ideas section, it is mentioned that the optimal antibiotic treatment for early Lyme disease continues to be controversial among physicians and the general public. The findings of this study highlight the importance of counseling patients on the risk of subsequent infection with Lyme or other tick-borne disease and instituting appropriate preventative measures. This study supports the use of short-course therapy with the antibiotic doxycycline for early Lyme disease patients. They recommend future studies should try to identify reasons physicians prescribe prolonged antibiotics for patients with Lyme disease in the absence of peer-reviewed data and against the recommendations of local and national treatment guidelines, which suggests that shorter course treatments of antibiotics are just as effective as the long term.